So for a patient with Lassa fever, before the patient is discharged, there are discharge criteria. Patient should be discharged if any of the following criteria are met. This one now is going to the NCDC guideline 2018 for Lassa fever. It says the patient should meet these criteria before being discharged. One, the test RT-PCR, reverse transcriptase polymerase chain reaction, testing on day 10 should be negative and the patient is afebrile. Patient has no fever, test is negative, patient can be discharged. Or two, in centers without facility for testing for the RT-PCR, discharge patient in the absence of signs and symptoms after 10 days of treatment. So if patient has received treatment for 10 days, there's no signs and symptoms suggesting of Lassa fever. Even when the test cannot be done, patient can be discharged as far as there are no symptoms. But the third one, for patients who still have symptoms, but the results turn negative, patients should not be discharged home. Rather, they should be discharged into an appropriate ward for subsequent management. So in this patient, they still have symptoms, but the test is now negative, which is a good thing. But instead of discharging them home, you discharge them to separate parts of the facility for further management. Then the fourth point, RT-PCR, which is just if it's positive after treatment, but there are no symptoms suggestive of Lassa fever for 72 hours post treatment. Patient should, however, be followed up and oral ribavirin must be given at 500 milligrams 6 hourly for 7 days. Okay. So in this instance, the test is positive, but the patient has no symptom. There are no symptoms suggestive of Lassa fever for 72 hours after treatment. Patient has been treated for 10 days. 72 hours after treatment, no symptoms, but the test is still positive. These ones can be discharged. However, they should have a follow-up and they should take the oral drug, ribavirin, given at 500 milligrams 6 hourly. That's 4 times a day for 7 days. So if the patient is still RT-PCR positive at day 10 and still symptomatic, treatment can be extended for 5 to 10 days. So the treatment is usually for 10 days, but if there are symptoms and the test is still positive, treatment can be extended for another 5 to 10 days. Recommendation for follow-up. Patients should be followed up weekly for the first 3 weeks and monthly for the next 3 months. So what this is saying that the patient is discharged, will be coming for follow-up every week for the first 3 weeks. And after the first 3 weeks, now every month for the next 3 months. After discharge, patients should be evaluated consistently for hearing loss and other complications. Nursing mothers should not commence breastfeeding until breast milk tests negative. Remember, the breast milk can contain Lassa virus. Supportive nutrition is encouraged for babies whose mother's breast milk tests positive for Lassa virus. The semen should be tested after 3 months, and patient advised to avoid unprotected sexual intercourse during this period. So the virus can persist in the semen of a patient who has been discharged. So semen can be tested after 3 months. During this period, while the patient waits, patient could avoid do abstinence, or if he must have sex, there has to be protection with use of condoms and all that. If semen remain positive, patient should be counseled on the use of condom. All these things should be noted. So the last main item here is Lassa fever contacts. A contact is defined as a person who has been exposed to an infected person or to an infected person's secretions, excretions, or tissues within 3 weeks of last contact with a confirmed or probable case of Lassa fever. So if you have been exposed to an infected person, the person was confirmed to have Lassa fever, you are regarded as a contact. If you are exposed to the infected person's secretions, you know, saliva, and things coming out from the body, excretions, you know, through passing stool or vomiting, or tissues, within 3 weeks. Remember, Lassa fever symptom, the incubation period is 2 to 21 days. So a patient that has been exposed to Lassa fever is supposed to show symptoms within 21 days. So if you within the last 21 days you had contact with someone who had Lassa fever, you are regarded as a contact. It's categorized into category one is low risk, no risk. That means the level of contact was minimal. Low risk, there was some contact, but you have some protection. High risk, there's high level of contact and you were not putting on any protective things. Although experience is limited, post-exposure prophylaxis ribavirin should be considered for high-risk contacts of confirmed cases. So if a contact, somebody qualifies as a contact, the person can be commenced on ribavirin. The options is called prophylaxis, post-exposure prophylaxis. Just like you have a needle prick. If you are collecting sample from someone who is infected with a disease and you now prick yourself, you are now exposed. There's post-exposure prophylaxis. There's treatment that can be given that prevents you from getting the disease or from getting very sick with the disease. So in this instance, ribavirin, which is used in treating the patient that has Lassa fever, can be given to those who have contacts, high risk contact. The options is you can give intravenous, give through the vein 100 milligram per kg at start. The person continue with oral drug. That's option one. Option two, the person doesn't receive injection. It takes the oral dose or oral drug, oral ribavirin 500 milligram by mouth every 6 hours for 7 days. So those are the treatment options. So oral ribavirin must be started immediately. This NCDC guideline immediately after the high risk exposure, but not before counseling the patient. So you have to counsel the patient first before starting patient on the drugs. Because if you want to, somebody is a contact, it's not confirmed to have the disease. It is exposed to somebody who had the disease, and you want to start treatment for that person. You have to counsel the person. This is the reason we are giving you the drug. It's not that we say you have the disease, but there's a high chance you may have you may develop the disease subsequently. So we are giving you this drug to protect you. You understand? So patient must be informed about the efficacy of post-exposure prophylaxis for Lassa fever, that the efficacy is unknown and that minor adverse effects often occur. So the patient should be told that this drug we are giving you is not a guarantee that you will not develop the Lassa fever, but it's something that can protect you, but it's not a guarantee. And the drug itself has some side effects, so you should know these and these are the side effects of the drug. Then the drug must be taken with food. You take it when you want to take it, you have to take food before you take it. Take it along with food. So the index case must be tested for Lassa fever with the cessation of ribavirin if the test results are negative. Okay. So if let's say someone is suspected of having a Lassa fever, and if someone is suspected and the contact of those people who are receiving treatment, and the test of that suspected patient was taken for test, if the test turned negative, then there's no need for those who are contacts of that person to be on treatment. So that's that point. All contacts must be counseled and monitored for 21 days, which is the duration, the incubation period. PCR testing for Lassa fever reserved for contacts that develop fever equal to 38 degrees Celsius or other signs and symptoms within 21 days of last exposure. So the testing is not for everybody. The testing is for the patient who is suspected to have it. Then the contacts of that patient, you know, you don't test them until they develop fever or they develop other symptoms within 21 days of exposure. So that is the point there.